everyone again. I'm so happy to see you again here and Talking Hands Listening Eyes on Postpartum Depression, PLEP. We have another episode with us today, and today we are talking about some of very common things that mothers go through in their life as mothers, some experiences that they go through, and some has a lot of myths, some has a lot of misinformation, and we are here to break all these myths and these misinformations. I'm here with a friend of mine who is also a registered nurse. She's a midwife and passionate about neonatal health. Her name is Rhoda Kaburu. We are so excited to be here. We are at Kangemi Health Center, where we have come to learn more and to engage more, and this is a journey that we are working with moms. In a life of a mother, mothers go through family planning. And when I talk about family planning, it's a very sensitive issue to many, because some have information, some have the wrong information, some have no clue of where to start when we talk about family planning. And with me is Rhoda, who will walk with us the journey of family planning. She'll explain to us various family planning methods and what we need to know about them. Rhoda, welcome, and thank you very much to join us.
Thank you, Judy. My name is Rhoda Kaburu, a registered nurse at Kangemi Health Center. Like Judy said, I'm very passionate about maternal and neonatal health, and family planning is a major component when it comes to maternal and the neonatal health. So on the family, we're going to speak today about the family planning methods that we have available and the side effects. We're also going to talk about the facts and the myths and misconceptions and ways how to dispel these myths and misconceptions. So family planning in a nutshell is embracing the number of children that one is able to raise and putting a space in between the children, of course, according to how a person can be able to raise these children. So when we talk about family planning, we have a breakdown of three types of clusters of family planning methods. We have non-hormonal methods, we have the hormonal methods, and we have the natural methods. On the non-hormonal, like it's being called, it's non-hormonal. There is no hormone. Hormone is a medication that is put into another medication to be able to prevent pregnancy. When we talk of hormonal, there are hormones that are put into this medication to be able to stop pregnancy. And when we talk about natural, it's neither hormonal, neither non-hormonal. So I will break down all the methods from the non-hormonal and then to the hormonal, and also talk about the natural family planning methods. When we go to the non-hormonal methods, we have the most common one, which is the coil. The coil, most of us, or the population, knows it as a coil, but scientifically it's an intrauterine device, a device that is put inside the uterus of a woman, at the door of the uterus. I will use the most layman's language so that I may be able to talk to this deaf mother or even the non-medic person. So the coil is a device that has, it has how you insert it. And this part here, it has a copper component. The copper component is the one that makes the sperm not reach to the egg, hence no fertilization taking place. So the coil, like I said, it has a lot of misconceptions on it. Some of them being that it's going to penetrate to the heart, it's going to move around the body. But I strongly want to say from fact that is not true. The moment it is put from a registered qualified person, it is supposed to remain at the place where it is put without moving to any other destinations. There are instances of whereby a mother will conceive even having a coil, and it is true, it happens. It's not only about the coil. We look at other methods, and none of the methods is 100%. So the fear about that, my friend conceived with a coil and another friend did not conceive with a coil. The truth be told, all bodies are different. One person, a body can as well reject the coil or something, as long as it's something man-made, it's not 100%. So it's possible, yes, I agree, it's very much possible to conceive even if one has the coil in situ. And this coil, the advantages of this coil, it protects a woman from getting pregnant for 12 good years. So it doesn't mean that if you put the coil today, you stay for 12 years without conceiving a baby. That is not true. You can put the coil today, and after 1 week, after 3 months, after 1 year, after 5 years, the period when you feel that you want to conceive, you just go back to the health facility, the coil is removed, and you comfortably conceive. Major advantage of the coil is that return to fertility is instant. Instant, like you don't need to take so long for you to conceive because it has no hormone. There is no hormone that was displayed in your body. So the moment the coil is out of your body, it means the sperm and the egg can just meet and you have a baby. So that is one of the facts that people should really understand, because when you say it's 12 years, it doesn't mean you have to walk the whole of 12 years without conceiving a baby. Something else about the coil that they say that the partner is likely to feel the coil during sexual intercourse. That is not true at all, because we do it, we measure the length. If the women, the anatomy is different. We are all created different. Like I said, we are all unique. So if you go to a facility, a qualified health worker will take a measurement of you. This is the way we do it. We'll be demonstrating that another day. So if I feel that this coil is not appropriate for you, it is my duty as a health worker to advise you that this is not the appropriate method. I'll teach you the other methods and you're able to choose, because we have a variety of methods. So I'll go to for the non-hormonal, we only have the coil. So I will go to the hormonal methods. On the hormonal methods, we have the implants. Implants, it's a method that is put under the skin. You put it under the skin of a woman. We do it more oftenly on the left arm, which is the less active arm. But if a mother is left-handed, it is okay to do it on the right arm, as long as that arm is the less active arm. So we have two types of the implants. We have the 3-year implant and we have the 5-year-old implant. For the 3-year, it's just a single rod. And for the 5-year, there are 2 rods. Commonly, you will hear about a jadel, you will hear about an implanol. The jadel is the 5-year-old one, which has 2 rods. And both, they also have misconceptions as well. For example, you hear a person saying the same rod, if it's put under your skin, it's going to move to the heart, it's going to move to the leg, any body part, but that is not true. I want to dispel the myths that as long as it's done by a qualified health worker, it is meant to stay at the position where it was inserted until a duration where it's either expired or you want to conceive. Similarly, I'll say even the 5-year-old, for example, you go seek for the family planning and you told you don't have the 3-year, you have the 5-year, don't shy off from taking the 5-year, because it doesn't mean it has to stay in the body for 5 years. You get it, you'd rather have it than have a pregnancy that you've not intended, because you can have it and 6 months down the lane, you're ready to have a baby. Just go to the facility, it is removed and you conceive. The same way with the 3-year. If you want to conceive after 1 year, you just come back to the hospital and get it removed. Point to note, you should ensure that if the duration is 3 years, the moment the 3 years elapse, that day when the 3 years are now completed 3 years, it doesn't offer any protection to you. So you need to go to the health facility, it is removed and you're able to conceive. In case you remain with it, it is not protecting you at all. So it means you can still get pregnant. So for the implants, there's a little bit of clarification. If you look at the 2 gadgets that are used to insert an implant, they may scare you off. Like for the 3-year one, you look at it, it looks so large. And for the 5-year-old one, it looks like some kind of a very sharp thing. But get this from me, it's a very short, I wouldn't call it even a surgery. There's the misconception that women tell one another there, like the implants, it's a whole operation. Like you get a big thing put under your arm. They imagine it's kind of an operation because they are wondering how does it get under your skin. But fact is, these are only holders. The thing that gets to your body is this small gadget, and of course, there is your skin is numbed. You're given a little medication, and I can assure you it is painless. You only feel the pain during the injection to get the skin numbed. The moment the skin has been numbed, these gadget is only to lead me inside your skin, because this is a very clean procedure. If you contaminate, it gets an infection. So it comes specially packed to lead me inside your skin. And the moment I put this inside your skin, I follow the markers. This is the beginning mark and this is the ending mark. I shouldn't go beyond the 2 markers. And the moment it's in, I now take my rod and push it slowly inside until it dislodges in your skin. And the moment I'm on this mark, I pull the other gadget outside and the implant remains under your skin. So kindly, it's not a major procedure like most of us are told outside there, and it's not as painful as it may look like, that I can assure you. So on the side effects, our bodies vary. Some will say that I added a lot of weight, I lost a lot of weight, I could not enjoy my sex life. All these are bodies that are different, and there could be other factors triggering. Of course, if you take a lot of food, excessively food than the normal food, you're bound to add weight. If you deny yourself food, you'll definitely lose weight. So gaining and losing is not associated with the family planning methods. Another point to note, in case you have serious side effects like too much bleeding, you're supposed to come back to health center. Every side effect that you experience, don't get information from the community out there. Just come back to the facility, explain to health worker, this and this is happening. You discuss together, and if the problem cannot be solved, of course there's a management. Removing it immediately is not the immediate answer, because you'll have to switch to another method. They have similar hormones inside them. They have the estrogen and the progesterone. We'll talk about another day. But any side effect that you experience, don't base with the myths, don't listen information from the community, just come back to the health facility. So I'll go to the other method. The other method, which is hormonal, we have the injectable. This is a very common method. Most of us love it. I think it's just because it's just a needle, it's just a jab, which is given once in 3 months. The depo. Everybody knows about the sindano ya kupanga uzazi. So this depo, it's an injectable type of family planning given once in 3 months. And like I said, if you don't come back after the 3 months, you're definitely going to conceive. And it still happens. Somebody was given an injection and they still conceived, even the injection being in the span of the 3 months. Again, point to note, there are people who will come to the facility, they are already a few days pregnant and they get the injection. Then like 2 months down the lane, they come back to the facility and they say that they got pregnant when they are having the injection already in their body. But if you follow keenly, if you take history from this person, you will realize that she was already pregnant before she took the method. So again, it's not 100% like the other methods. And some of the side effects would include a little bit of nausea, because it's an hormone inside it. And the other myths, like it makes a person cold. There's that kukua baridi. Kukua baridi, it is not scientifically proven. It's all in the mind. But like I said again, in case of any side effects that one experiences, it is important to go back to the facility and you're given the right information. Then I'll go to the pills. Sorry. On the pills, we have 2 types of pills. We have the combined pill. The combined pill is a 21-day pill whereby you take the pill every other day. And if you decide you're taking it in the morning, should be always in the morning. If you decide it's in the evening, should be in the evening. In case you forget a pill, immediately you remember you're supposed to take the pill, but it is not okay to take 2 pills at the same time. For example, I was to take my pill today. I realized I didn't take tomorrow morning. See, the 24 hours have already elapsed. I should not take the 2 pills at the same time. The moment I remember, I take my pill. And if you've missed more than 2 pills, you're advised to use another method, because if you take them skipping, you're definitely going to get pregnant because the hormones released in your body are not consistent. Then we have the lactating pills. The lactating pills have only one type of hormone. I may not get into the details of the hormones, but at least let's know we have the lactating pills, the breastfeeding, mothers who are breastfeeding up to 6 months, they are advised to take this kind of pill because it does not interfere with the milk production. If you're breastfeeding, maybe you've left a baby, it is important to tell your health worker, like, I have a small baby, because if you're given the combined one and you're breastfeeding, it is going to tamper with your milk production. So the same hormones, they both work the same way. If you skip a pill, kindly remember to take a pill immediately you've remembered. If you miss more than 2, get another method before engaging in sexual intercourse. For the side effects, they are the similar side effects I said of one may experience this and the other one may experience this. So let's not have a communal side effect. If you feel you cannot handle the side effect, kindly you go back to the facility and not get to the chemist or manage. Your neighbor tells you, I was given this drug, so you can take this drug. Everybody is very much unique. So we go to the barrier methods. The barrier methods include the condom. We have the male condom and we have the female condom. The male condom, of course, is for the male partner, and the female condom is for the female partner. The main advantage over the condoms, besides all these other methods, the condoms will prevent you from any sexually transmitted diseases, including HIV, as well as pregnancy. And if a condom is used correctly, consistently, it is also more advantage of preventing you from a pregnancy. Besides this 99, we call it 99.9% accurate compared to these all other methods. And then now finally, we have the natural types of family planning methods. These are, it really calls for discipline for you to practice the natural family methods. This is counting of the days. You come to the facility and you sit down with a health worker with a calendar. She'll explain to you your most active. You'll tell her how your cycle is, and she'll be able to guide you. During this period, you are unsafe. During this period, you're safe, so you can engage in sexual intercourse. We have the temperature methods. We have the counting of the beads, and we have the temperature. Yes, the temperature method. So when you come to the facility, you're taken round to all the methods that I just spoke to, and it's now your duty to settle on a method of your choice without the health worker interfering. I think that's very much for today.
Thank you. Yeah. Thank you very much. I think that's a lot of information, but I have some few questions. Okay. In family planning, are there unmet needs?
Yes, we do. Mm-hmm. I go ahead?
Yeah, go ahead.
Okay, some of the unmet needs include male involvement. Mm-hmm. It's an unmet need because the male gender assume that family planning is for the women. Mm-hmm. So they are the only ones who come to the clinic without the company of their husbands. Mm-hmm. In such a way, in even some scenarios, a mother will come and want to have a method in secret. Mm-hmm. You find the implants that we put under the arm, she wanted to be put in a very conspicuous part where a partner will not tell. Mm-hmm. So it has not, they associate it with with promiscuity. Mm-hmm. And if you practice family planning, you're going to have several partners, mm-hmm. which is not true. So that's a met need that we should very much bring our men on board, so that they are able to understand that family planning is an advantage to us all.
It's not only so as you speak about men, does it mean that family planning is for women only, or is there family planning for men?
Practically, the family planning methods that are there for men, mm-hmm. we only have the vasectomy. Mm-hmm. There's an injection. It's under research. It has mm-hmm. not yet come out to the market. Mm-hmm. There will also be an injection, like the 3-month injection for the women. Mm-hmm. There will be an injection for the man. But whatever method is on the ground right now is mm-hmm. the one we call vasectomy. Mm-hmm. Yeah, whereby their tubes are cut down and they're not able to produce healthy sperms.
In all this family planning, different methods that you've shown us today, does it only protect pregnancy, or does it also protect other sexually transmitted diseases?
Like I explained, all the other methods, apart from the condoms, do not protect against STDs, including HIV. Mm-hmm. Only the condoms that protect against pregnancy and HIV and other sexually transmitted diseases.
If I am a mother, I've come to you for the family planning method, apart from the condom, which may not have a lot of effect, and I'm pregnant. Will it have an effect to my child?
Definitely, it may have an effect because already this is an hormone. It would deter the growth of this baby. It would lead, like for example, if it's a coil, but before we get to having you have a method and you're pregnant, it is now my negligence. It is my due duty to understand that Judy is not pregnant. Ways of ascertaining a person is not pregnant: you can do a urine test if the mother is breastfeeding, at least from the last monthly period. So before I give you a method, it is my due duty to ensure that you're not pregnant. But in a nutshell, it is not advisable.
Okay. Yeah. My last question there is that if a mother is breastfeeding, is it important to take family planning method? Because there are people, and I don't know whether this is a myth, you may tell us, that who say that if you're breastfeeding, you can't get pregnant.
Very good. Judy has taken me back to a method of family planning. Breastfeeding is also a method. It's among the natural family planning methods. But this breastfeeding, we are speaking about exclusive breastfeeding, whereby you're in 24 hours, you're breastfeeding this child like 8 to 10 times. Okay. If you're going to faithfully breastfeed a child in 24 hours, 8 to 10 times, then you can settle for breastfeeding as a method of family planning. We call it lactational amenorrhea. This is during this period of breastfeeding, your periods have not come back. So if your periods have not come back, chances of you getting pregnant are very minimal. But if you're faithfully breastfeeding, you cannot get pregnant.
Wow. Yes. Thank you very much. That was a lot of information and more detailed. And I'm sure as a mother out there who is feeling you don't know what to do in matters of family planning, Rhoda has explained it so well to us, and we are so grateful, Rhoda, that you've made it easier for many moms out there who may not have gotten an idea, or we confuse this method with this one, of course, with the myths in it. We are so grateful. Thank you very much. If you are a mother there who you may want to get more details about family planning, Rhoda is ready to work with us this journey at a personal level, because we are all at different levels. And Rhoda, maybe you could give us your parting shot in terms of family planning, and you can speak to a mother out there who is not sure of which family planning method she wants to use.
Thank you very much, Judy. My parting shot about family planning, I would really encourage that let's have a child at the time when we desire. Let's have children that we can be comfortable to take care of, and let us get facts from the health facilities on the type of family planning methods we can settle for.
Thank you very much. We are so grateful as Talking Hands Listening Eyes in terms of support we've gotten, and also to this health facility, Kangemi Health Center. We'd say it's a choice for every mother to live a happy life in terms of family planning, because we already exposed now, we already have information, we know what we need to do. We now know the real fact on the ground, not what you hear from your friend, from your mother, from your cousin, from so many women around us. We are here to get information, and the right information. And maybe you are there and you may want to get personalized information. You may want to reach Rhoda. Please reach to us through 0769 811 399. And here we will be able to give you more information through Rhoda. We may connect you to Rhoda. You may come to Kangemi Health Center as well and ask for Rhoda. Rhoda Kaburu, you'll meet her. She's a very wonderful lady and always ready to help. In case you're a deaf mother out there who is struggling with matters of family planning, let's walk the journey with Rhoda, because she's here and she will help us as we fight this big elephant of postpartum depression. Let's know all those many other triggers that make postpartum depression so much in our lives. And until next time, I'm so grateful, and may God bless you.